Did you know that there's an organ in your body being silently destroyed while you sleep, work, and go about your daily routine, and you don't even suspect it? And that there's a medication you might already be taking every day, but nobody ever explained that it's actually saving this organ from total failure. I'm Dr. Olivia Thompson, a medical specialist in integrative health, and today I'm going to tell you the hidden truth in your medical prescription. A truth that can save you from hemodialysis, give you years of quality life, and most importantly, make you understand that that small pill you take for blood pressure or diabetes isn't just another medication. It's a protective shield for your kidneys. And if you're over 50 years old, if you live with diabetes, hypertension, or high cholesterol, stay with me until the end of this video, because this information can literally change the course of your health. Let's start by talking about something everyone forgets: the kidney. Think about it. When was the last time you stopped to think about your kidneys? We worry so much about the heart, the brain, the liver, but the kidneys stay there, quietly working 24 hours a day without receiving any attention. And do you know what they do? They filter all your blood, remove toxins, balance the minerals in your body, control blood pressure, and still produce essential hormones for you to live well. Without functioning kidneys, nothing in your body works properly. And here's the problem. Chronic kidney disease advances slowly, without making noise, without giving clear signs. You don't feel pain. You don't have obvious symptoms. When you finally start feeling something, extreme fatigue, leg swelling, shortness of breath, you've already lost more than 60% of your kidney function. By that point, the damage is already done. But I'm going to tell you a secret that few doctors have time to explain in a rushed 15-minute office visit. There are medications you might already be taking or should start taking that act as true guardians of your kidneys. And I'm not talking about miraculous supplements sold on the internet or empty promises of dubious natural products. I'm talking about medications validated by decades of solid science, studies with thousands of patients, medications that have already saved millions of kidneys around the world. Let me tell you a real story that happened in my practice. His name was Louis, 63 years old, diabetic for 12 years. He took his insulin properly, controlled his sugar reasonably well, thought he was doing everything right, until during a routine visit, his creatinine test came back abnormal. The nephrologist looked at him and said, "Louis, your kidneys are working at only 45% capacity." Imagine the despair. He started imagining dialysis machines, needles, 3 times a week stuck in a hospital, limitations, the end of the freedom he valued so much. But the doctor did something that completely changed his story. He adjusted the medication. He didn't increase the insulin dose. He didn't add more diabetes medication. He simply switched one blood pressure medication for another and added a small pill that Louis didn't even know existed. 6 months later, kidney function had stabilized. A year later, it had even improved a little. Louis came out of the dialysis risk zone, and he told me with tears in his eyes, "Doctor, nobody ever explained to me that these medications did this. I thought they were just to lower blood pressure." That's exactly what I want to show you now. What are these medications and how do they work silently to protect what you have most precious? The first group of medications are the famous blood pressure medicines, but with a secret superpower. I'm talking about ACE inhibitors and angiotensin receptor blockers. Have you heard of enalapril, captopril, losartan, valsartan? Yes, these names are on the prescriptions of millions of people, but most people think they only serve to lower blood pressure. The truth is, they do much, much more than that. They reduce pressure inside the kidneys, protecting those microstructures called glomeruli, which are the microscopic filters responsible for cleaning your blood. When the pressure inside the kidney is too high, these little filters start to rupture, scar, and die. And when they die, they don't come back. It's permanent. But these medications relax the arterioles that carry blood to the kidneys, decreasing this internal pressure and preserving the glomeruli. Robust scientific studies with tens of thousands of patients followed for years show that the use of these medications reduces the risk of kidney disease progression in diabetics by up to 30%. 30%. This means hundreds of thousands of people who won't need dialysis simply because they took the right medication. Are you already doing this? If you have diabetes or high blood pressure and aren't taking a medication from this group, you need to talk to your doctor urgently. Now comes the darling of modern medicine, the medication that revolutionized kidney treatment in the last decade. I'm talking about SGLT2 inhibitors, those medications with complicated names like dapagliflozin and empagliflozin. They were originally created to treat diabetes, but became the absolute stars of kidney protection. Do you know what they do? They take the excess glucose circulating in your blood and send it straight to your urine, making you eliminate sugar through urine. It sounds strange, but it's genius. Because when you have diabetes, your kidneys work overtime trying to filter and reabsorb all that glucose. It's like they're running a marathon every day without stopping. Over time, they become exhausted, inflamed, start developing fibrosis, which is like an internal scar, and gradually lose function. SGLT2 inhibitors take this weight off the kidneys. They let the kidneys rest a bit, reduce inflammation, decrease fibrosis, and literally save the organ from destruction. The numbers are impressive. Patients who use SGLT2 have 35% less chance of needing dialysis throughout their lives. 35%. And there's more. These medications also protect the heart, reduce hospitalizations for heart failure, and still help with weight loss. It's a medication that works on multiple fronts at the same time. Imagine the results with this simple change in your prescription. And there's a medication that everyone talks about when it comes to cholesterol, but very few people know it also protects the kidneys. Statin, simvastatin, atorvastatin, rosuvastatin. Yes, that medication you take to lower bad cholesterol is doing much more than cleaning your arteries. It's protecting the microscopic blood vessels that irrigate each nephron, each functional unit of your kidneys. How? By reducing vascular inflammation, improving blood flow inside the kidney, and preventing fat plaques from forming in those tiny arteries. When blood arrives well to the kidneys, they function well. When flow is poor, they suffer. Statins keep this flow healthy. A giant study with more than 50,000 patients showed an 18% reduction in kidney disease progression among those who took statins compared to those who didn't. 18% may seem small, but when you multiply that by millions of people, we're talking about lives saved, years gained, entire families that don't have to see a loved one trapped to a dialysis machine. Now I'm going to introduce you to the newcomer of the group, the medication being called the kidney anti-inflammatory, and that promises to revolutionize kidney disease treatment in the coming years. Its name is finerenone. It's a non-steroidal mineralocorticoid antagonist, and I know this name sounds like it came from a science fiction movie, but what it does is very simple and very powerful. It blocks the action of hormones that cause inflammation, fibrosis, and scars inside the kidneys. Remember that fibrosis I mentioned before? That scar that gradually destroys the nephrons? Finerenone prevents it from forming. It stops the destructive process before it becomes irreversible. This medication was recently approved and has already shown impressive results in patients with diabetes and mild to moderate kidney disease. In clinical studies, patients who used finerenone had a significant reduction in kidney disease progression and also fewer cardiovascular events. It's a medication that protects kidneys and heart at the same time. And the best part, it works together with the other medications I already mentioned. It's not one or the other, it's everything working as a team in favor of your health. And I can't fail to mention metformin, the classic of classics in diabetes treatment. Almost every type 2 diabetic has taken or takes metformin, but few know it also has a protective effect on the kidneys. How? It decreases oxidative stress, which is like rust accumulating in kidney cells. It controls glucose smoothly and constantly, without peaks and sudden drops. And this is fundamental because kidneys hate blood sugar roller coasters. In addition, metformin improves mitochondrial function of kidney cells, which are the energy powerhouses of cells. When mitochondria work well, kidney cells work better, live longer, and resist aggressions better. Of course, metformin only works if the kidneys are still functioning reasonably well. That's why the doctor needs to adjust the dose as kidney function changes, and sometimes even suspend the medication when function drops too much. But while you can use it, it's a powerful ally. Now you must be wondering, but Dr. Olivia, why didn't anyone tell me this before? Why did my doctor never explain that these medications did all this? And the answer is simple and sad at the same time, because in the office, in 15 minutes of consultation, the doctor needs to check your blood pressure, review your test, adjust the prescription, listen to your complaints, answer your questions, and still fill out a bunch of bureaucracy on the computer. There's no time left to explain how each medication works in your favor. What's the logic behind each choice? Why one medication is better than another in your specific case. But it's essential that you know that pill isn't just for blood pressure. It's not just for diabetes. It's not just for cholesterol. It's a soldier working 24 hours a day, 7 days a week, to keep your kidneys alive, functioning, and healthy. And when you understand this, you start valuing each pill, taking it at the right time, not forgetting, not stopping on your own. Because now you know that each dose is one more protective shield. Going back to Louis, that patient I told you about at the beginning, after a year taking the right medications, adjusted by the nephrologist, he not only stabilized kidney function, but improved several aspects of quality of life: less fatigue, less leg swelling, more energy to play with his grandchildren, more disposition to live. And most importantly, he no longer needs to live with that paralyzing fear of the dialysis machine. He gained years, maybe decades, of autonomy and health. This isn't a miracle. It's not luck. It's not destiny. It's science. It's prevention. It's well-done medicine. It's the result of doctors who study, researchers who dedicate their entire lives to understanding how to protect vital organs, medications that were exhaustively tested before reaching you. And it's within your reach now. So my final message to you who's watching me now is this: if you have diabetes, if you have hypertension, if you have high cholesterol, if you have a family history of kidney problems, talk to your doctor about these medications. Take this video to him. Ask if you're already using these protections or if you need to start. Don't wait for symptoms to appear. Don't wait to feel pain, fatigue, or swelling. Don't wait for the creatinine test to come back abnormal and scare you. Kidney protection starts now, today, with the right choices. And always remember, your kidneys don't cry out for help, they don't hurt, they don't warn you. They fail silently, little by little, until one day you wake up in front of a dialysis machine wondering how you got there. But you can protect them before it's too late with medications that already exist, that are already proven by decades of scientific studies, that have already saved millions of lives around the world and that may be within your reach today. Based on international nephrology and cardiology guidelines, based on studies published in the best medical journals in the world, these medications are powerful tools that modern medicine has placed in our hands. The difference between using them correctly or not can literally be the difference between aging with health, independence, and quality of life, or facing dependence on a machine, severe dietary restrictions, frequent hospitalizations, and all the complications that come with advanced kidney failure. It's a choice you make now, talking to your doctor, understanding your prescription, valuing each medication you take. Stay with me here on the channel because taking care of your kidneys is taking care of your future. And that future starts now, at this exact moment. If this video helped you, if you learned something new, if now you look at your medical prescription with different eyes, leave a comment down below telling me. Share it with that person you love who needs to hear this message. Subscribe to the channel and turn on notifications so you don't miss the next videos where I'll continue teaching you to take care of your health with science, with truth, and with a lot of care. I'm Dr. Olivia Thompson and I'll see you in the next video. Take care of yourself, take care of your kidneys, take care of your life.